A lot of people ask me this question, so I want to use this opportunity to deal with it before we go. They ask me, how often can someone who has kidney stone do CT scan? Okay, CT scan is actually a very comprehensive procedure that can actually help your doctor to know the real situations with your kidney. In fact, it's not only in kidney stone management that your doctor can actually ask you to go for CT scan. Your doctor can ask you to go for CT scan if you have issues with the brain, if there's something structurally or functionally wrong with a person's internal system, organ, that the doctor wants to actually know what the problem is. People with wound, with brain issues, with liver, stomach, you can name them. So your doctor may actually need you to do CT scan. Therefore, someone with kidney stone, um, most of the times we have disparities with scan results. The truth is that everybody may be reporting what they are seeing, and they may make mistakes, either because of the machine they are using or the expertise of the person that is actually doing this. So a lot of things can actually make the reading of a CT of normal ultrasound scan not to be okay. So now the doctors now depend on this scan, called the CT scan, to be a final judge of what is happening in the kidney part time. So that is why your doctor may actually ask you to go and do CT scan. So with CT scan, look at what the doctor, there's something we call HU. The doctor needs to know about the HU of that kidney stone, that's the weight of the kidney stone. The doctor also needs to know the size of the kidney stone, and the size is also actually recorded in mm. So um, if the size of the kidney, the CT scan will also be able to know if this CT scan, if these stones are multiple, their sizes, their weight, and their positions in the kidney. Okay, in the video I did last, we talked about different positions of stone. We also said the stone could either be in the upper pole, the lower pole, and the middle pole. And we talked about the treatment modalities that you can use for any of them. So if you are joining us for the first time, I'm Honorable Victory and I'm your kidney health coach. I teach people how they can actually become free from kidney stones and how you can actually manage kidney stone properly. So in my group, in this channel you're watching, you discover that I have a lot of videos, more than 150 videos on kidney health, and mostly on kidney stones. Okay, on how you can actually crush, dissolve, and flush out kidney stones. Okay, so and also I also have a WhatsApp group where I educate people on how to do all these things on daily basis, apart from the one you're watching on YouTube. So we have our WhatsApp community where we take out time to tell people on how to actually have a very good kidney. Even those who have kidney failure, we have a class where we teach them how they can actually maximize their treatment and become better. Okay, I tell them that kidney failure is not the end of life. You can actually do better with your life. So aside from that, I also offer a paid consultation section. So the consultation sessions are not free, and for the personal coaching, they are also not free. So but if you want to be part of that, because I don't know when you're going to be watching this video, and times changes, so you can request to have our WhatsApp link, so you can become part of our WhatsApp community, enroll into the consultation sections, and um, take proactive steps about your kidneys and elongate your stay on earth. Okay, so having said that, so the CT scan, how often are you going to be doing the CT scan? The CT scan exposes you to radiations, thousands of radiations. Okay, and as a person, you're not supposed to be exposed to numerous radiations within a short period of time. So we actually advise that one CT scan is enough, at least one in 3 months. If you can do it once in 6 months, it's okay, or once in a year, it's okay. So CT scan is not something you go and you keep doing it every day. Every day, it's not something that you keep doing on a regular basis. Okay, so having said that, because if you keep doing it, even the radiations, if you are exposed to so much radiation, there's tendency that it could actually cause cancer. Okay, and it's also good for you if you are mother or the rest of them. So there are conditions that you don't even need to get near the wave. So exposing yourself frequently to this wave is not the best for you. Thanks for watching this video. I'm Honorable Victory, your kidney health coach. Please